advances in technology, isn't ultrasound and attaining competency itself getting easier?
I think people like to think that. I think that, as the price of ultrasound machines have become cheaper, it's made them more broadly accessible to more people. But it doesn't matter if you've got a $250,000 ultrasound machine with all the bells and whistles on it, or a simple ultrasound machine that's handheld that's got just a couple of buttons. This is like a fighter jet compared to a little Cessna aeroplane. You still have to learn how to fly. You still have to learn how to take off properly. You still have to learn the basics before you can graduate up to be able to use all the bells and whistles on a machine. And so much of the ultrasound examination is that hand-eye coordination and the complex psychomotor skill development that is the right hand getting the picture and maneuvering it into the right position to get the best view on the anatomy. So it doesn't matter how complex the machine is or how simple the machine is, you still need to be able to get and acquire the image well. So as much as the technology is advancing and it is becoming cheaper, it doesn't compensate for a lack of skill in the user. And ultrasound is so operator dependent. So all the technology in the world doesn't compensate for the fact that you can either hold the probe and get a picture or you can't. Obviously, some of the pathologies and stuff can be easier to see if you've got great technology and all the bells and whistles. You can demonstrate more detail about it. Whether it be advanced color settings and you can see better blood flow or whatever, if you've got a really complex ultrasound machine. But if you haven't got the view in the first place and you can't actually see the anatomy, it doesn't matter how expensive and complicated the machine is. So as much as there are advances in technology, it's not compensating for poor operator, and it's not and as it gets cheaper, there's more people who can afford to do it, but that doesn't mean they have the skill to do it.
You mentioned you've been doing this for 10 years, and in your experience over the past 10 years, what myths have you witnessed that obstruct collaboration? And in your opinion, how could some of these challenges be addressed?
I think we've touched on some of them before. I've done my 25 cases now, or I know in North America it's a few more than that, but I've done my ticket now. I've got my credential. That means I can teach it. I think that a lot of people can have more confidence than they should in their skills, and then without dedicating. Just because you're good at something doesn't make you a good teacher. And I mean, that's across anything that you're teaching. Just because you can do it well doesn't mean that you have the skills to be able to teach it well. And so we find that one of the most challenging things, because increasingly there's people with a little bit of experience who think that they're great at it, that are trying to teach it. And so the next person that comes along is being taught, and they might pick up some stuff. They might even be very studious and go and watch heaps and heaps of videos. But if they have too much confidence in what they're doing, it can actually lead to adverse patient outcomes. And I think one of the biggest dangers in ultrasound is overconfidence of the operator in their skills, so that either they don't ask for help when they should, or they overcall things, or they miss things and say things are normal. So it's a big patient safety risk, I think. So the see one, do one, teach one myth is quite tricky, because you still have to train a workforce. So you still have to have a number of people who need to be able to teach it, but they're not necessarily good teachers. There are some fantastic tutors, but just because they're good at the skill doesn't mean that they're good teachers. So I mean, I had that when I was training as well. I watched for ages and ages, but The difference that a good instructor can make is incredible. When you've got someone who is teaching well, your learning curve is accelerated, but you also have a more realistic appreciation, I think, of what can go wrong. I guess one of the other things that we sort of face too is that obstructs collaboration is just this view that I can only learn from my colleagues. So doctors can teach doctors and sonographers should teach sonographers. Certainly at our place, we've always had a combination of sonographers and docs. So the doctors are concentrating on teaching the clinical applications, and here are the cases where it went really well, and here are the cases where it didn't go so well. But the sonographers, who are the experts at the technical side of things, at getting the picture, are probably in the best position to teach how to get a good picture. So we've always, at our institution, had a combination of doctors and sonographers teaching. But I know in some places, without mentioning any particular specialty group, one in particular comes to mind where it's like, they wouldn't be seen dead being taught by sonographers because they have to be taught by their colleagues. And their colleagues might be very good at it, but doesn't mean they can teach it. And their colleagues make a whole lot of assumptions about how much knowledge they have and sort of start the teaching halfway up the ladder. So I think collaboration and having sonographers who are experts at the technical side of things, at the getting of the pictures and getting really good images to make a good diagnosis, that's what we have a particular expertise in doing. So we're best to teach you how to get the pictures. Whereas the doctors have that expertise in the clinical application of the tool. So, they're best to teach you how to use this in the clinical management. A sonographer can't do that. So I think the collaboration between docs and sonographers is much better than sonographers on their own who can do all the technical stuff but not the clinical stuff, or doctors on their own who can do the clinical stuff and maybe a little bit of the technical but haven't fine-tuned those technical skills as much as a sonographer has. So I think that the whole thought that I can only learn from my peers can be damning. And certainly at our place where we're teaching obstetricians, emergency physicians, intensive care, anaesthetics. We're teaching across a lot of different disciplines of medicine, and that cross-pollination of ideas is really unique, I think. There's things that emergency folk can learn from anaesthetists about doing nerve blocks, but they don't necessarily hang out in the same room all the time. So they've got their tribes and they sort of stick to their tribes. And I think that's one of the unique things at our place is because we're teaching across many different disciplines of medicine, we can cross-pollinate those ideas between those disciplines.
What role do events like the WCUME or your event Sono AUS 18, what opportunities do those events present in the field in terms of collaboration and getting everybody into the room together?
I think something like the World Congress of Ultrasound gets lots of disciplines in the same room. Everyone can learn from anyone, whether it be good things or bad things. You can, by having the different disciplines and the different, having the expert professors in the same room as the med students, there are things that I learn from young folk every day, different ways to look at things. Just that collaboration across the work experience sort of continuum, whether it be a beginner or an advanced user at clinical stuff, or for example, the ultrasound in medical education, there are students coming out of the universities in North America that are now having better skills at ultrasound than some of the physicians that they are working with who might be attendings or whatever. And I understand that can create some tension, but I think if everyone was to leave their ego outside the door and was to be trying to view this from the point of view of everyone can learn something from someone else, then it is really good. And certainly conferences like this encourage that. But probably are preaching to the converted, really. If we could disseminate that through the population, it'd be much better. But it's kind of like in real life, you know, you got your teenagers who just think, oh, they're old folks. They've got nothing to teach me. And yet, you know, by the time they get old enough to realise that those old folks are going to move on, and geez, they're so wise and could have taught me heaps of stuff. It's a little bit late. So I think certainly, you know, our Sono Oz event, we're hoping to cross-contaminate the emergency side, emergency docs and critical care docs with the paramedics and sonographers. So if everyone is in the right frame of mind for learning and pops their ego outside the door in the little ego box, then there's a lot to be learned from everyone.
Great. Well, thank you so much. This has been really wonderful and so informative to get your perspective on this. And finally, can you tell us where we can get more information about Ultrasound Training Solutions as well as Sono Oz, please?
So our Ultrasound Training Solutions website is www.ultrasoundtraining.com.au, and the Sono Oz website is www.sonoaus.com.
Perfect, and we'll make sure to link to that as well as to your social media on our blog post. So thank you so much for your time.